Hey guys, I'm Dr. Amy, and I am here. I have the pleasure of being here with Dr. Amy as well. This is Dr. Rick Amy. He is a chiropractor, but he has a head full of knowledge. He is like the grandfather of cold laser therapy, and he has worked with some of the best and the brightest out there on cold lasers and done a ton of the research upon which most other cold lasers are based. So we're going to take some time to talk about the Avant cold laser, which is one of our sponsors for Base Camp. And we're really excited to have Avant as a sponsor because they have been in our back pocket for a long, long time. Dr. Amy, tell us a little bit about what you do.
Well, thank you very much, Dr. Amy. So Amy squared, I guess, today. So you get double the dose at the battle. So when we're looking at lasers, I love when you say in our back pocket, because lasers have come so far in 20 some years since I've been working with them. When we set up the first lasers, they were big and they were bulky, and we could only use one diode because you just couldn't keep them cool. Now we have these fantastic lasers that are powerful. You have multiple different lasers in them, and we can put a bunch of presets in. So I was introduced to lasers back in 1998. And as you say, I'm a chiropractor. And so my thought is always neurology, neurology, neurology. And so the most important part, and my mantra is that we can't have immunology or healing without neurology. That's why it's so important to adjust the spine, because the spinal receptors have actually input into the immune system that helps the body as well as inhibit pain. So I use all those things from my neurology and my postgraduate training with Dr. Carrick back in 1996 and 97. So I'm dating myself. We had a great class with Dr. Dan Murphy. Dr. D'Onofrio was one of the first ones that put me into there. And we really learned a lot about how the body is wired. So I took those same principles using chiropractic and adjusting the spine with lasers. So just to give you an idea, people have been trying to get cold laser therapy approved in the United States for 40 years prior to when we got it. And the reason was it was mostly based upon pain. And my pain is different than your pain, different than a middle linebacker playing for the Dallas Cowboys. We all have different pain and amount of mu receptors and a whole bunch of different things, but pain is subjective. So it was very, very hard for them. What I did, I created clinical protocols that were based upon guidelines from the AMA for pain and disability, which includes movement such as range of motion and muscle strength. So we were able to show clinically that we could change neck and shoulder pain. That's what the clinical trials were on the majority of patients by decreasing their pain, increasing range of motion, and increasing strength, which is phenomenal. So those clinical trials really were important, led to the first FDA market clearance. And we did this with a red, low level, under 50 milliwatt laser. Today, we have some more powerful lasers here using the Avant. And we also have the ability to do two different lasers, a red beam and an infrared beam. So I'm not sure if you know, but right now there are over 6,000 peer-reviewed articles in the best journals in the world on what we now call photobiomodulation therapy, right? So I want you to really understand that. In 2015, J.J. Anders and their group with Walt went in and said, low-level laser, cold-level lasers and that, they're sort of where we're at, but we're really what the laser does, it's a biomodulator. So what does biomodulation mean? It means it takes something that's inflamed and at too high of a rate and brings it down and takes a chronic condition like hip dysplasia or something like that and brings those cells back up. So the modulation is so incredible. And in those 6,000 studies, they use two different types of lasers, red and infrared. And we have the beauty to have two lasers in one unit, which is absolutely fantastic. And then you combine that with the ability to put all these frequencies or hertz into it. So now we have frequency specific things for things that we treat every single day. So Amy, give me maybe your top 3 things that you would be using a laser for every day.
That's a great question because we use it for literally everything.
Right.
But honestly, the patient that comes in most often, well, we have 2 kinds. One would be the athlete who's coming in to really hone, so the barrel racer, the roping horse, those are coming in because they're just a little off today. And then the other end of that spectrum that we see a lot of are those dogs that can't walk. They're down, they're paralyzed, they can't get up. So those are our typical 2 ends of that spectrum that we see the most of.
And we, yeah, thank you. And we know the difference, like in the barrel racing and doing these things, and I used to treat a lot of elite athletes, is we're not, and I actually did drag racers and that. And the difference between winning and losing is 1/100th of a second, right? So we know that just a little number and a little change is what does it. But that's where the laser comes in because it resets the neurology better than anything else. We worked with Lance Armstrong and a lot of the athletes. And what we do is we treat them before they go in, right? So we have them tuned up. We want their muscles balanced. We want their neurology. We want their gait, right? That gait is so important to be in harmony and to be working in order with those horses so they have that good and they respond instantaneously. That's where the laser really excels. And then we have the other side. So we have both of these sides here where we have degenerative neurological disease and we have arthritis, but we really have a lot of inflammation as a consequence of that arthritis. But usually with arthritis, the load either from trauma or just repetitive use goes onto the joint where it really should be back on the muscle. And we can restore that muscle strength in dogs and horses in literally 60 to 120 seconds to take the load off the joint back onto the muscle, which does what? Decreases pain and closes that pain gate. It is so phenomenal. It's so instantaneously, it's so fast. It really works with any practice. And that's one of the things I look for. When I'm looking to bring something new into a practice, I'm looking to really, number one, does it work? And with the studies we've had, and I've done it for 20 years and trained over 25,000 different people on lasers, we know it works. So we can take that out. Number two, does it work in my setting, in my office, or the way that I want to do it? And can the patients perceive it and understand the benefit? And I think we really have that down too. And then does it really work as far as my situation in the flow of the office? And can I take it and do the things? And then the most important things, will people pay cash for it and will they travel to do it? And that's the key for me. If they'll pay cash for it and they'll travel to come see me, absolutely, I know that I'm getting better. I know that my word and what I do and my tools are really so important. I'm sort of like Felix the cat, the old cartoon. I want as many tools in my armamentarium as I can because I'm trying to help as many patients as possible.
Awesome. So in terms of animal chiropractic, we know that it intersects with that pretty well based on what we're hearing, right?
Absolutely.
So tell me a little bit about how these animal chiropractors are going to be able to, how are they going to be able to integrate this into their practice? Like, how are they going to be able to know when to use the laser and when not to use the laser?
Well, I'm pretty biased, but I'm going to use it on every single visit. If it is now, we have to range. So when people come to me, I'm a little bit different, right? Most of the time in chiropractic, animal visits, things of that nature, you're doing it on a adjustment or per session, and maybe you're not doing complete packages.
Right.
So that I know in my things that I want to include it in every single visit, but that's really up to the business model. And I know you're really good helping with that. So if this is going to be an a la carte, we're going to have to charge for it and they're going to have to pay for it. But really, every time that I'm doing an adjustment, I want to use the laser in combination to make sure the adjustment holds. Have you ever heard that? Oh, I came in, I did my horse and that, and they walked down and I worked the next day and the adjustment was out. What we're trying to do is we're trying to use the laser in combination to keep the adjustment there longer. So again, muscles move joints and we need to have good symmetry And this is when the laser comes in. So the better and the faster I can get them is good and bad.
Yeah.
Because I get them better fast, they don't need quite as many visits. But the thing is I get these long terms, and then they start to understand the importance of that wellness model, right? So before they go out to the barrel race, they knew that they need to come in, and then afterwards they need to come back to make sure that we have everything in balance. Now, here's where we really can excel where no one else can excel. All those neurologic problems, like I just treated a 11-year-old dog, about 60 pounds, a little bit of a mixed terrier and some lab and some different things that had shaking leg in his back leg, right? Shaking tremors. Been going to the veterinarian using a hot laser, right? Different than a photobiomodulation. Was paying $75 a visit and was seeing some reduction in pain, but the tremors weren't going away. I treated it 3 times, right? Tremors went away. We treated it 3 more times, and they haven't been back. That's on an 11-year-old dog. You just can't do that any other way. And so besides the chronic things, we get a lot of traumas. We get a lot of, dog bites. We get different things that also need the immune aspect. And this is really where you have another edge. So we got the neuromuscular pain syndromes. We have the chronic arthritis. We have the sports injuries. And now we can treat things that have an immune response too as well, understanding that both the adjustment and the lasers works great for the immune system.
I almost don't want to ask this question, but I feel like I need to. We have a lot of, particularly our veterinary crowd. They have a lot of lasers out there that are not cold lasers. They're not the low level. They're, class 4 wattage kind of lasers. Tell me what makes the Avant laser a better choice.
So a class 4 laser, I can tell you there's 6,000 studies on the photobiomodulation. There's probably less than 50 to 75 on class 4 lasers, if you want to know. Class 4 lasers work on heat. And so when I heat an area up, I increase circulation, which is great, right? So I'm bringing more blood supply to help the healing points and immune factors into it. And as I do that, I increase the frequency of firing of the nerve by 3 meters per second, which doesn't sound like a lot, but it's enough to break the pain gate. So I start with pain. So that's where the class 4s are. But you can heat someone up. You always have to keep it moving. And there's a lot of different variations, and you have to be very, very careful. So it works on a heating mechanism. Photobiomodulation, going back to the other, works on a photon energy. Every cell in your body talks through laser light, right? So there are receptors for both red and infrared. This is the number one thing. The red is where the perfect harmony of a healthy cell is. When a cell replicates, and all cells are replicating, whether it's a skin cell, bone cell, muscle cell, and when it replicates, it emits light between 630 and 640 nanometers in the perfect shade of where we are with our red beam at 637. So that is the key to photobiomodulation. And we've proven way back in 2001, there's a lot of misnomers that the low-level lasers can't get that deep penetration. We proved in 2001 for Dr. Rodrigo that we can see changes, cellular changes without heat, 2¼ inches into the body. We did abdominal MRIs under electron microscope, and they are phenomenal. So we have a larger variant. We don't have to be as exacting, so we can do no harm, number one. And that's the thing, those 6,000 studies, no side effects. Number one, can't do that with a class 4. You got to be very careful. And then the photobiomodulation, and then the combination of red and infrared. So we get twice the bang for the buck. And there's receptors on the cells for red and infrared. So why would I do one when I can do both? So as you say, 2 heads are better than 1. Well, we have 2 laser heads, which are much better than 1. How's that?
That's great. Which brings us to, are people going to be able to pay for these lasers? I mean, is their practice going to be able to generate enough income to actually pay for this thing?
I can tell you, just so that you know, people come to us all the time that are owners of animals and buying lasers. because it's cost effective, right? So if you're getting 6 treatments for $300 and you can get an entry model for $4,200, it doesn't take you long to get that back with a chronic dog, right? So rate of return can be hugely, if depending on the size, right? If you have a big practice and you're going and let's say we have a small practice, let's go the other way. Let's say we're seeing 1 patient a day at $25, which is about a third or half of what's normal. So that's 100, right? So it's 400. So we would get $400 a month. So in 10 to 12 months, we would be able to pay that off on 1 person at half the price. Now, let's say we put it to $50. So we go from 400 to 800, but we're only seeing 1. Then we pay that off in 6 months. And let's say that we see 2 a day at that, we pay it off in 3 months. So rate of return, I don't know, a lot better than Dogecoin, interim, any of the stock market stuff. You're going to get a great rate of return. And that's really the beautiful part. I will tell you that most of the veterinarians that are doing this, as well as some of the other ones, but it seems like the veterinarians a little bit ahead of that one, not saying all, is that they will get the top of the line laser, and then they will get the pet laser, and they will rent that one out, which pays for both of them, right? So now they're charging $120, $150, some are, depending on it, $200 a week, which is $800, and that pays for both of them in like 6 months. So rate of return, I'm not worried about that. You're not going to see any of these lasers usually on eBay. They just don't happen, because this laser at $6,000 is better than any laser at $15,000, because it's 2 true lasers. We have frequency specific in there for treating a whole variety of different things. It's simple and it's easy, and there's a nice curve in it when you're using it. So you don't have to be exact like you do with the class 4.
Awesome. So for our attendees at base camp, we know that they always get a little something extra. So what can our attendees at base camp expect to get as a little extra bonus when they come to base camp?
Okay, well, I'm going to have to talk about that one, but I'm not sure 100%. That really comes back from the company, but I'm sure that there's going to be something there. It might be a free stand and a charging cradle, which is about $400. Those would probably be some of the things I would be thinking about that usually they do. Again, I can't be that one. I'm the talker. I'm not the owner.
No worries.
But I know there will be a bonus.
I know Pamela told me that they're putting together some pretty important information to send home with our attendees as well. That'll give them more information about the laser and how to use it and how to build a practice with it.
And that's where you really come in with the practice part of it. That's where you also come in, because you have materials, right? You have posters, you have other things, and you have pre-programs, which are really important. So I can tell those that are a little skeptical and not being able to sure how to do it. I've never had a laser. This is uncomfortable for us. We make it so simple for you, and we have such good support to help you through it. That's really what makes the difference too, is to have a simple starting places. And as you get better, you grow with it, you get comfortable, you start thinking, and this is really where I want you to go. I want you to start thinking about everything you've learned, physiology, everything you've learned about animal adjusting, everything you've learned, and then use the laser as an extension of what you're already doing. And you will see profound effects, and you will see miracles. And we're here to support you on that.
That's awesome. So where can they get a hold of you, or where can they who can they contact if they want to have more information about the Avant cold laser before the conference?
Before the conference, they could go to my website. You can see a lot of different things. Not going to be so much animal generated, but that's drrichamey.com. And I'm going to show you a bunch of case studies and that more on the human side. And then again, avantwellness.com if you wanted to purchase, or either way, we would make sure that we get you handled.
Awesome.
Answer any of your questions you might have, and then we go through. Now, remember, there's a 3-year warranty, so that's complete. And if anything breaks down after 3 years, you only pay for the parts. You don't pay for any of the labor, right? So you ship it there, they fix it, you pay for the parts, they ship it back to you. So they're really good about taking care of their the people that buy their purchase their lasers.
Thank you.
Mm-hmm.
We have always been so happy to work with Avant because of just that. We call them up, we ship it in, they ship it right back. And just like you said, with our lasers, we rent them out to our clients all the time. And that the simplicity of the laser is what makes it work so well. Clients can turn it on, laser their animals every day if they need to. And then we charge for every single day that they've got it out. So if they've got it out for a month, we're charging for 30 days worth of laser use.
Yeah. And it works for both. It works for you, right, as the owner of the laser. And the owners are happy because they don't have to be coming in. They can treat their animal every day, multiple times a day. And then you know what they're doing. They're probably treating themselves too, you know.
We, you know, as veterinarians, we don't really tell them to treat themselves, but we do tell them how we would treat the animal if they had that problem.
Exactly. So we know that's this. But the nice thing about it too is the animals are great. There's no placebo effect into it. You see the horses, I love it when they give you that big yawn and that stretch as they're unwinding, and then you get the movements and everything start to come back as they want to be engaged with it. So the laser is very calming for most animals.
Well, thank you so much for joining me today.
So my pleasure.
To find out more, drrichardaimee.com or avantwellness.com. Thanks for joining us, you guys, and we will see you at base camp.